Hello everyone, hope you all are doing good. So today we will discuss about some of the famous triad system wise. Okay. So first system we talk about is one of the most important system known as cardiovascular system and trauma. First triad in the cardiovascular system is Beck's triad. Now what does it signifies? It is seen in the patients with cardiac tamponade. So what are the three components of Beck's triad? So it comprises of muffled heart sound, distended neck veins, as you can see here in the picture, and hypotension. So the BP of the patient will be decreased along with the distended neck veins. Second triad is Cushing's triad. So Cushing triad is seen in the patients with raised intracranial pressure. Now, what are the components? Let's see. So we have hypertension, means increased BP, bradycardia, and irregular respiration. Third one is the lethal trauma triad or a death. Components are hypothermia, means the temperature will be lowered for the body, coagulopathy, and acidosis. Fourth is our ruptured abdominal aortic aneurysm. It is a very severe condition, and the triad we see here is hypertension along with pulsatile mass and severe pain. The second system we are going to study is gastrointestinal system. The first triad is Charcot's triad, which is seen in the patients of ascending cholangitis. The components of triad are right upper quadrant pain, fever or rigor, and jaundice. Now, second one is Macular's triad, which can be seen in the patients of esophageal perforation. The components of triad are vomiting, lower thoracic pain, and subcutaneous emphysema. Next is Rigler's triad, which can be seen in gallstone ileus. The components can be understood as small bowel obstruction, ectopic gallstone, and air in the bile ducts. Next important system we have is neurological and systemic systems. First triad is Hakim's triad, which can be seen in the normal pressure hydrocephalus. So the components are jade disturbance, urinary incontinence, and dementia. Patient will be having the symptoms of forgetfulness, and it will be difficult for the patient to control the urine flow. Now, second we have is Horner syndrome. The components in the Horner syndrome are ptosis, as you can see here, the eyelid is a bit downward, and then miosis, the size of the pupil is decreased along with the anhidrosis. Next triad is Wernicke's triad. Now for Wernicke's triad, we have to learn the triad of ataxia, confusion, encephalopathy, and ophthalmoplegia. Brain and eyes both are involved along with ataxia. Next we have Besset's triad. You can see the triad includes oral ulcers, genital ulcers, and uveitis. Means mouth, genitals, and eyes all are involved. Now, uveitis refers to this image in which iris, ciliary body, and choroid all are inflamed and infected. Fourth and the last system we are going to study about is the musculoskeletal and rheumatology. So first triad in this system is reactive arthritis triad, very important from exam point of view. So we have arthritis, urethritis, and conjunctivitis, means the renal system, joint, and eyes all are involved here. Second is unhappy triad or O'Donoghue triad, which can be associated with knee injury. So the components here are anterior cruciate ligament, medial cruciate ligament, and medial meniscus. All the three of them are damaged in this triad. So when these three symptoms or these three casualties are there in the patient, we can say the patient is showing knee injury with unhappy triad. It has a very poor prognosis. That was it for the video, guys. I hope you found it helpful, and if you do so, please share it with your friends. Thank you for watching. See you in the next one.